So I've been seeing more and more female bodybuilders come to my practice with one very specific problem, and that is complaints that the clitoris is too big. Now, there are a few reasons, well, two reasons in particular, this may bother the bodybuilding community more than, let's say, other communities. First of all, is these patients have very little body fat. So if the clitoris is enlarged, it will be a lot more obvious. In many patients who have more body fat, the clitoris will be well hidden by the outer labia in particular. But if we're already dealing with somebody who has very little fat to begin with, there's really nowhere for it to hide, and it can be a lot more obvious and a lot more distressing for patients who are bothered by it. The second reason is if a patient has a history of taking performance enhancing drugs, many of those drugs, anabolic steroids, are testosterone basically, or they affect the testosterone receptors. And in the clitoris, there are receptors causing growth of the clitoris if you take these hormones. And I've seen patients who've been on them just for a very short amount of time in the past, and the clitoromegaly, or the enlarged clitoris, tends to stick around. In some patients it'll go away after they stop using it, but it really depends how long they've been on it, and in my experience it's not very forgiving. A lot of the time the changes will stick around. Surgery for clitoris reduction, or clitoroplasty as we call it, usually involves a few different steps. One of the most important things we usually do is get in and get rid of that erectile tissue. We'll bring this back, and basically that erectile tissue bothers a lot of people because it causes like an erection basically when they get aroused, and oftentimes the clitoris will double in size during arousal, and so if a patient already feels like she's too big, this can be very distressing during sex, for example. In a lot of patients, we'll reduce down the head of the clitoris as well. We say the normal size clitoris should be about 0.5 centimeter across for the glans or the head of the clitoris, so many times we're doing that too. We're oftentimes doing a lift down there and reducing the skin around it, such as the clitoral hood, and it's very common we'll do a labiaplasty as well. Many patients I see have had a labiaplasty already. Sometimes this can make things a little worse actually, because again, you're just uncovering the clitoris itself, which is too big. Not many plastic surgeons do clitoroplasty, but it is and has been over the past few years a growing part of my practice.